All right, what's up, guys? My name is Mason, and for the special needs project, I did eosinophilic esophagitis. And the general overview, eosinophilic esophagitis, also known as EE, is described as a chronic immune system disease. And what happens is eosinophil, which is a type blood or a type of white blood cell, it builds up in the lining of the esophagus. And here, the esophagus is what connects the mouth to the stomach. And I put a picture right here of what the esophagus is, and then this picture on my cursor right here is eosinophil. And then what creates the extra amount of eosinophils? So the surplus amount of eosinophils is a reaction to foods and food allergens, and the excess amount of eosinophils creates injury or can inflame the esophagus's tissue. And when there is damage to the esophageal tissue, it can create problems like struggling to swallow food or even choking on food. And some symptoms of eosinophilic esophagitis is the difficulty of swallowing food, and food getting stuck in the esophagus after swallowing. And this is also known as impaction. It has chest pains, regurgitation, and vomiting. And treatment and management of the condition. And I put diagnosis right here. And so if a doctor suspects EE, the patient will undergo blood tests. And within these blood tests, the doctor is looking for an excess amount of eosinophil counts or a higher than normal amount of immunoglobulin E levels. And if either of these issues happen to be the case, then it does suggest a food allergy. And below, I put a blood test right there, and then I put a picture of, my bad. And then I actually, put a picture of an excess amount of eosinophil cells right there. So that's like an extra amount of them. And then after being diagnosed, if a patient does end up having this disease, he or she may have to do a trial and error with different food groups. And what I mean by trial and error is like a diet, like testing out different foods. And I said here, the patient will have to give up a food group for an X amount of days, such as wheat, dairy, soy, beef, eggs, and shellfish. And this is also known as the elimination diet. Title this Nutrition, the Elimination Diet. And to further explain the slide before, the patient will first do an endoscopy to count the extra white blood cells throughout the esophagus and the stomach. And once the count is recorded, the patient will then cut out the food groups I mentioned before for around a month. And once again, this is dairy, soy, beef, eggs, and shellfish. And after a month on the new diet, the same patient will then be brought back into the hospital to be examined, and or to be examined on the new count of eosinophil cells. And this will be the controlled amount, or the normal amount a human should have. And once this patient has reached the range that is normal, he or she is ready to start adding food groups back to their diet, but one food group at a time. And so here I just put a picture of like an endoscopy. I've got a better picture on the next slide, but that's essentially what it looks like. Like they'll stick a camera pretty much down your throat. I title this Nutrition and Treatment, and the elimination diet continues. So throughout the course of this diet, the patient will add only one food group back, and then will be tested 3 months later for yet another count of eosinophil cells, again using an endoscopy. The doctor running the tests will look for the count of eosinophil cells, and if the range of these cells consists in the same range as the controlled count, then the patient is not allergic to that food group. However, if the eosinophil cells break that control barrier, then the patient is then like allergic to the food group testing. And this pretty much continues all the way until all the food groups are covered. And here I put just a real life picture of an endoscopy, and this is what it ultimately looks like: the patient laying on the side, while the doctor is using the tube, like with the camera on the end, to look through the esophagus and stomach. And yeah, so treatment and medication. So the next step in this process would be to try different medications. And first off, the proton pump inhibitor, or also known as the PPI, which is an acid blocker. And most patients with EE experience that the PPI does not actually improve any symptoms. If the PPI does not work for the patient, he or she will then be prescribed a topical steroid such as fluticasone or butanide. And both are liquids swallowed to treat eosinophilic esophagitis. Sorry, it's really hard to pronounce. But since EE is a chronic disease, this is to be taken daily and sometimes twice a day, depending on how bad your like food allergens are or food allergies are. And if neither works, then dilation or stretching of the esophagus is recommended. And this would pretty much be every time it just gets hard to like eat foods and whatnot. Then you would have to get your esophagus stretched out, so it's like easier to swallow foods. And so then I've got a fun fact of the day. Throughout this PowerPoint, I've used the term "this patient" when describing the process one might go through when dealing with this sort of disease. And the catch here is that I actually was that patient. During my sophomore year of high school, I was diagnosed with EE. It took 16 years to find out why I could not eat food like the average person, and it took several different doctors to finally diagnose me. And I just happened to be lucky enough to stumble across the doctor I did. Because originally, growing up, I would always complain, like I would always eat so slow because I would be scared of choking on my food. My mother would always tell me, take smaller bites. And nothing ever helped. So I got really lucky. And then the next slide is the impact and effect towards physical activity. And so, like I'm just kind of explaining my process through it and what I experienced. Not everybody will have the same experience as me, but this was my experience. So at the end of my sophomore year, in June, I was at the time a 210-pound middle linebacker for my football team. And at the start of the very next football season, which was just a couple months later, I was 175 pounds, completely different position, played slot receiver because I just didn't have the weight to play my previous position. So the amount of weight I lost through the elimination diet was insane and probably one of the worst things to go through as a high school student and an athlete. And every day I was more tired than the last, with not being able to eat the foods I needed to replenish myself. I was also very jealous of my friends and what they were able to eat. I remember we'd do like football camps and everything, and all of my friends, could eat sandwiches and whatnot, like during the breaks. But I was stuck eating cold cuts because that was the only thing I was allowed to eat. And so my conclusion. Towards the end of my junior year of high school, my doctor reached out to me and recommended I try one of the topical steroids. And because I was really allergic to every food category, it was really my last hope, and it turned out to be the best thing that did happen to me. After experimenting with topical steroids, I was able to eat food again without choking or having difficulty swallowing my food. And I would compare it to me waking up in a whole new world. And since then, I've been able to eat what I want and when I want it. Thank you.